to all of you. And if you are able to turn your cameras on, that's wonderful because I like to see people's faces when I talk. So it's great to thank you for those who do have your cameras on. Uh, so yeah, I started right after the law passed to regulate the profession for the first time. So I've been involved with all the rules and everything since the very beginning. So today I'm going to present kind of an updated version of certification and licensure. I've added quite a few slides recently from the old version because there's a lot going on. And I would prefer to take questions at the end, and or you could put them in the chat and Nadir will keep track of those at uh, that time. And I will look at my watch to make sure we have time for questions at the very end. So I'm going to start sharing my screen. So certification licensure in Wisconsin. So our state from the very beginning has something called title protection that not all states have. And it basically prevents people from using the title social worker, which unless they are actually a certified social worker, advanced practice social worker, certified independent or licensed clinical, which is one of the reasons that we got credentialed, regulated, because in the past people were using social work for people that had, high school diplomas and they did terrible things and looked terrible in the profession. So some of the definitions. So we did change, the beginning, everything was certified, and then we changed the clinical level to licensure. And what that basically means is that you could not provide clinical social work services unless you're a clinical social worker. And in Wisconsin, nobody can do psychotherapy unless there's a master's or PhD level practitioner, for in mental health. 4 categories of regulation in Wisconsin. There's the bachelor's level, which is the certified social worker, the certified advanced practice social worker, and I'll go through all 4 of these with the entry-level masters, certified independent social worker, which is the advanced generalist, very few people have, and then the licensed clinical social worker, which, and I'll be going through these. So a certified social worker, although it says has a bachelor's or master's in social work, that's what the rules say. It's actually for people, once you get your bachelor's, that's what you get as a CSW. And the bachelor's, someone with a CSW cannot engage in psychotherapy. So even if you have a master's degree, you cannot engage in psychotherapy until you get the next category of certification, which is the CAPSW, Certified Advanced Practice Social Worker. So people that get their MSW, then they apply for the Certified Advanced Practice Social Worker, and they are able to engage in psychotherapy under proper supervision. So, many people, but not everybody who get their MSW will do that. Independent social worker. This is somewhat of an archaic level. And I was grandfathered in because, I was practicing then. And it's for people basically that are advanced generalists and not clinical. They've completed 3,000 hours of practice under supervision. They may engage in psychotherapy if properly supervised. Very few people actually go for that after they get their certified advanced practice social worker, because it doesn't really help you necessarily get advance in your career. There might be some exceptions, but someone who wants to upgrade to a CISW needs to be supervised either by another CISW or LCSW. Now, LCSW, where a lot of people go for this. Someone who holds a master's or PhD in social work, but primarily master's, they have to have a clinical social work concentration in graduate school, and I'll explain what that is. They've received supervised clinical training. We'll go through that, and they've had supervised practice. Now, an LCSW has a tremendous benefits in our state, and one of them is they can engage in psychotherapy without supervision. And one of the reasons that we are so strict in our state, and you'll see when I go through the requirements, is that anybody who gets an LCSW, the next day they can engage in psychotherapy without supervision. So for an LCSW, you have to have an MSW. You have to have had a CAPSW. And in your graduate school coursework, you need to have had a course on psychopathology and social work, or a course that covers that topic, like covers the DSM, and 2 additional clinical courses. And it's very broad what those clinical courses can be. 3,000 hours of supervised practice. This is pretty universal nationwide. There's a few states that have 4,000. Um, and of the 3,000 hours, 1,000 hours needs to be in direct client contact, at least 1,000 hours. And 600 hours must consist of diagnosis and treatment. And this is what distinguishes our requirements from other states that don't require that. Now, the supervision does not necessarily need to be your employment supervisor. Probably a majority of the time it is, but not always. Some people, because of their work requirement, need to go outside the agency to get the supervision, which is allowed. So what kind of work experience counts? Is someone needs to be doing primary mental health treatment, including psychotherapy, for a client using DSM to assess, diagnose, and treat people. And so we are a lot stricter than other states in that area. Some examples of the clinical settings can be an outpatient mental health clinic, inpatient psychiatric hospital treatment, some intensive in-home facilities. There are other situations that can count. Um, if some people may work at a, sexual assault agency, possibly domestic violence, if they're actually doing psychotherapy for the clients. And also, it could be at maybe well, certainly counties do this as well. But whatever the setting, you need to be getting the experience where you're um, working with clients with a variety of diagnosis. You're getting the experience learning about how to diagnose and treat people, and you're doing therapy with them. So someone that's just doing crisis intervention, that's not going to count. Supervision needs to be an LCSW psychiatrist, psychologist. The social work section has gotten more open, or however you want to say it in this, and they do allow LPCs and LMFTs and psychiatric nurse, but you have to request that in advance. And years ago they didn't like that, but now it's pretty universal that they will grant that. Supervision should average 1 hour per week over the course of the supervision. It could be more in the beginning when the person's learning, less at the end. You can do group supervision up to 6 persons. Video conferencing is allowed. I just talked to someone on the examining board. It is allowed for supervision. In terms of who can supervise, so the original requirements basically allowed anybody that got an LCSW to supervise. But, I've met with our clinical network, and they basically agree that is not a good idea, that just because you've gotten your LCSW doesn't mean that you can supervise somebody else. So I proposed to the social work section, and would have to eventually go through the examining board, that there be a minimum of 3 years of full-time practice before becoming a supervisor. That hasn't gone through yet, but I expect it will. And so people really should adhere that for prudent practice. The examining board is also considering and they're working on a rule, it's just starting, so it'll be a number of years, requiring a minimum amount of supervisory training for supervisors. Now, NASW itself, um, we had we had gotten requests for um, to establish a system where we could provide the names of qualified supervisors for people who need them, who are have their CAPSW and their employment setting doesn't have a supervisor. So we have basically basically hired two organizations that will be doing the training. It'll be a 10-hour training, and after once you complete that, then you'll be on our website as an NSW approved supervisor. The first training we expect will happen probably November, December of this year. And you know, at which point that the examining board does change the requirements, say to more than 10 hours, and we would uh, also change what we're doing there. So there are some various aspects of certification licensure that have been here since the beginning. You are required to report child abuse and neglect. You can apply for a temporary certificate um, for the CAPSW, CSW, and then you can get it renewed once. You are required as a clinical social worker to get malpractice insurance, 1 million, $3 million, 1 million for incident, $3 million total. Agents, if an agency provides it, the state law will allow that. NASW has always strongly recommended that people get their own malpractice insurance because if there is an issue at the agency is going to protect themselves first and you second or last. So we do recommend that, but the state law just says you have to have it one with the other. Uh, there is a continuing education requirement. You probably know that 30 hours every 2 years, including 4 hours of boundaries and ethics. I will get into uh, pre-approval things. This is not required during the first 2-year period that you become certified or licensed. So because they don't prorate it. Now the um, licensure period goes from March 1st of the odd year to February 28th of the 2 years later of the even year. And right now we're in the, March 1, 2025 to February 28th, 2027. Anybody that gets certified or licensed, uh, you know, during that time, will not need to start their continuing education hours until March 1st of 2027 because they don't require you to prorate that. Like certification licensure gives privileged communication for your client. So this is a really good reason, even if the title of your position is not social worker, which is when you'd be required, you should do this because it'll protect your records. There is information about psychometric testing, and I'm not going to go through all this now. It's kind of technical, but there are certain testing that you can do as a clinical social worker, and there's others that require additional a letter from your supervisor and different qualifications. Um, and if some of you have further questions, I can set up a Zoom meeting and go through the requirements with you. Now, MPSW 20 is the conduct code that well, it actually affects not only social workers, but marriage and family therapists, special counselors. And you should look that over. There have been some major changes that have just gone into effect. And I'm going to go through some of these changes right now. So record keeping, you have to do it, must be maintained for at least 7 years after the last service provided, unless otherwise provided by state or federal law. Now, if you talk to our NASW, our malpractice provider and basically our insurance provider, they would suggest that you basically you don't destroy your records because you could be sued at any time. But state law just says you need to keep them for at least 7 years, but you really need to probably consult with your malpractice provider even after the 7 years after you've retired or left before you would destroy them. Um, the new requirements say that you can never have sexual contact with former clients, and they say that you can't develop personal relationships for at least 2 years with former clients. They banned conversion therapy. Now the Joint Committee for Review of Administrative Rules has repeatedly suspended our rule. Um, but we have an active lawsuit through the governor's office that actually we had oral arguments before the Supreme Court in January. It's very exciting because it's our issue. And I expect a ruling from the Wisconsin Supreme Court anytime before the end of July in our favor. And so then they'll never be able to suspend it again. But the current rule, and they've held off, if we hadn't had this lawsuit, the JCRAR would have definitely suspended the rule again in January because they keep doing that. And their leader, the chair, has told other people they'll continue suspending it and never let us put it in. But we have the lawsuit. So it is a prohibited practice now. Um, the unlawful practice is basically that if you are supervising somebody, you and you and they don't have a social work um, credential, but they're calling themselves a social worker, that's unlawful practice, and you have a responsibility not to, allow them to practice social work. You have to comply with child abuse and neglect reporting. There is a provision that you need to provide adequate supervision. And this last one is kind of interesting because I've had contact from people. There have been supervisors who, the employee had a conflict and they left on bad terms. It wasn't necessarily the employee had malpractice, but there was maybe the employee was an advocate they didn't like or whatever it is. Um, and then they either may have resigned or they might have been fired. And then the supervisor refused to um, verify their supervisory hours, and that is illegal. It is, they made it clear in the conduct code that you cannot do that. Um, as you can imagine, that is not okay. So, as I mentioned, MPSW is the conduct code, and you should carefully review the document. And we talked about record keeping, 7 years. Now, various acts of certification licensure. Um, we'll talk about the exam, but um, if you move from one certification category to the other, in less than 5 years, you don't need to retake the state exam. Now, one of the things that's happened, it's not often it does happen, is so you, as I've explained, for an LCSW, you have to have certain graduate courses and you have to have a certain type of field placement. There are people who, and this is particularly true for people moving here from other states, there are people who didn't necessarily have these courses in graduate school. Maybe they had more of a macro placement, and their graduate field placement maybe wasn't direct service and they weren't doing mental health. So we got a law passed, I don't know, a long time ago that allows people to take these courses after their degree and allows them, and instead of 3,000 hours, you can do 4,500. So there is a way of doing this, even though you didn't do this initially. Now, reimbursement. Um, so most insurance companies will reimburse CAPSWs providing psychotherapy at state certified clinics. Not all of them. Those of you that may be like clinic owners, um, uh, you've probably have negotiated or you could negotiate with the insurance companies. There's one of our longtime clinic owners in the Dane County South Central branch area. She negotiated and lobbied all the HMOs and insurance companies in her region, and she got them all to reimburse CAPSWs. Um, so this is something I'm not saying that every insurance company does it in the state. Many do, but if you're happen to be a clinic owner, it's something that you could negotiate with. And if you want more information about that, contact me and I can connect you with the person who was so successful at that. Now, DHS will, and this is something we lobbied for, will reimburse CAPSWs for providing psychotherapy under supervision uh, to medical assistance clients. So this is a real benefit that CAPSWs are reimbursable. So it gives an incentive for outpatient clinics to hire them because they'll get money for their work. Um, at least doing medical assistance, but many also will do it at the insurance companies also do it. Now, LCSWs, they have lots of insurance reimbursement. Insurance companies are required to reimburse them. By the way, NASW got this with our vendorship bill um, in, I think it was 2000, and we carried the LPCs and LMFTs on our back. I know the whole history of that, but no, actually, it was not in 2000. This was when between 2009 2011, the 2 years I've been here that the Democrats are fully in control, we got our vendorship bill through, and that's when they were required to do that. Um, and the DHS will reimburse LCSWs providing psychotherapy to medical assistants in their private practice. And we did get that through. They also will reimburse LCSWs who are providing services in schools and in home. And that's something we had to lobby for. And I can tell you stories about that. But NASW got that through, and it wasn't true in the beginning. Telemental health, Medicaid reimburses for telemental health. Medicare is currently doing it. Our national office has been working on bills to ensure that this continues because this went into effect during the COVID-19 pandemic, and they're trying to get this permanent. Insurance companies currently are reimbursing that. They're trying to prevent laws that would require recertification every 6 months or seeing someone in person every 6 months. So um, there's been extension of the national law, and NASW and other groups are working nationally so that it keeps being extended. Now, any of you that supervise uh, staff, if you fire somebody for misconduct, you must report them to DSPS. Or if you suspend or restrict their employment, um, and it's for gross negligence or violations of conduct under MPSW, you must report it. And even if somebody resigns, sometimes people resign because they know they're going to be fired, you also must report that. And of course, you understand why. If somebody is engaged in misconduct, they need to be properly disciplined. We don't want them to go to another agency and just, do the same thing. And this is where you report complaints. Now, the other thing, okay, before I move on, I also want to say that, uh, uh, I talk to members every day on a variety of things. I help people with ethical issues, practice issues, licensure, certification questions, people from out of state. But I also get calls from people who have complaints made against them, and many of them don't have they're not valid, but but they're a disgruntled client who's upset with them, and they send a complaint, and it obviously freaks out our member, which you can understand. And so I do walk them through the process of responding to a complaint. I just had one a week or two ago, and you know, at least half the cases are thrown out. And I have to tell people that because, um, you know, unless there is the grievance really is connected to unprofessional conduct, just because they don't like what happened, and you know, with the social worker, it doesn't mean that it's unprofessional conduct. So I also help them kind of respond to that. Now, you probably know this, that we have an online system. You apply through License E at the DSPS website, dsps.wi.gov. Um, now, people that are moving here and they're licensed in another state, one of the issues is, and one of the reasons we need a social work licensure compact, we'll talk about that when I get to that slide, is it can take a long time to get licensed here. But someone who is credentialed in another state, they can apply for a temporary credential to provide services in Wisconsin while the Wisconsin application is pending. And that happened during COVID and it continues. So that's a positive. These are the fees. You should check them. Sometimes they change them. We have one of the lower fees in the country. Don't go to Minnesota. Their fees are really, really high. And it's because, you know, the department oversees all the professions. Minnesota's, you know, it's a social work board and they have to have their own budgets. But these are the fees that are there. And then this is the website, and anybody in Madison, there, this is the address of where the agency is, and here's the phone number. So exams. So you have to take two exams to get certified or licensed. The first one is a state exam. It is open book. It's online. It's taken after your application is submitted, and you receive your password and 10-digit ID. You can either purchase a booklet through the department, document sales department administration, or you can look at everything online, which is easy to do. Passing grade is 85%. Exam is untimed. You do it at your home. You can exit return anytime over a 3-month period. And the thing that I tell people, it states right on the website and here what sections of the statute the questions are taken from, and the code book goes to both the law and the rules. So what I recommend to people is that they, before they sit down to take it, go to these statutes, go to the code book, familiarize yourself where things are so you can go quickly through them when you take it, and you can kind of see where the where you're going to look up the answers. Um, Most people do it in one sitting, but as I said, you can take your time on it. Now, the national exam is something else. It is expensive. We actually protested the last time they increased it. Um, when they increased it up, jacked the price up, and with they, I mean the Association for Social Work Boards, but they didn't listen to us. So this is the price. It is 3.5 hour exam. You have to go to a setting, exam site for that. Um, if you don't pass it, you have to normally wait 90 days to repeat it, but they are allowing waivers. You'll receive authorization to make the exam appointment after the application materials are received. In terms of preparation, there is a booklet by SWB that's $30, e-booklet 15. We do exam prep workshops free for members, and we decided to do it free for members because of when we learned about the major disparities in the pass rate for diverse communities, people from English as a second language. And that's why we're doing a bill, which I'll talk about later. So these are ways to prepare for it. You can take your exam prior to graduation, and I suggest I talk to people, say it might be a good idea. So when looking for work, because I've already passed it, and you'll get the authority from the department, and then you contact the ASWB to take your exam. Now, there are four exams that ASWB does. Um, so almost, 99% of the people they're going to deal with the ASW bachelor's, the ASW master's, or the ASW clinical, so those are the ones you'll um, apply for when you get the authority to do that. Now, substance abuse counselors, some of this information here is a little bit outdated, and I need to tell you why. So currently, um, we got the law passed that if you're an LCSW or CAPSW or even CISW, you can legally do substance abuse counseling even as a specialty without additional credentialing. There is a specialty classification that we had in effect in the past um, for those people who didn't want to get the substance abuse counseling credential. Um, and these were people with us, CAPSW or LCSW, and this still required passage of the ICRC exam, 1,000 hours of face-to-face counseling, 180 hours of AOD special education. Now, for those of you that want to get the substance abuse counselor, as I mentioned, it's not required anymore legally to practice this. Um, it may be that some places of employment, even though it's not required, may want you to do this. I'm not 100% sure about that, but some people who want the substance abuse counselor, you have to get the SAC credential. You have to pass the ICRC exam, 360 hours of education, 3,000 hours of supervised practice, substance abuse counseling. BSW and MSW get credit. Um, they'll reduce the 3,000 hours by 1,000 for the BSW and 2,000. Now, um, you should know, and one of the reason we've lobbied for some of these other caveats is they still don't require that a substance use counselor even have an associate degree, which just boggles my mind. We had when the substance use counseling went to the state, because it used to be by a nonprofit organization. Some of you have been around a long time, remember that. It's got a certification board. We argued unsuccessfully that they need to have some, minimum requirements for like a social work or a mental health degree, a master's level to be at least a supervisor, and they just totally blew us out of the water on that. Now criminal offenses, we get these things. I mean, if anybody that has had a criminal offense, it's not necessarily going to disqualify you for social work practice unless it's substantially related. In some cases, the social work section or maybe the department now, I'm not sure how they're handling it, may ask someone to appear in person to explain the circumstances of that. Because people make mistakes, and they don't need to be, affected their entire life by that. But so there is um, a way of someone who has had felony in their background to still become a social worker. But if it's substantially related, they're going to have to do some more proof that they have overcome that. Reciprocity. So reciprocity is basically not. I tell people that coming here from other states that it really doesn't. There's only a very few states that it applies to. And so many people get tripped up on that. And I've asked the department to make it really clear about that. The only people who can get reciprocity for their LCSW in another state are people. There are a few states that have as strict requirements as we do. They don't, they can't. Now, the compact will solve this problem, which I'll get to later. Continue education. It's 30 hours every 2 years, 4 hours of biology and ethics. Ethics must be interactive. It's got to be either live in person or live webinar. The other 26 hours, I don't recommend it, but it can be home study. And you need to keep records of continuing education for 4 years in case you are audited. Um, Continuing education hours cannot carry over to the next credentialing period. If you have 40 hours in a 2-year period, you can't carry 10 hours to the next period. I mentioned there's no continuing education requirement during the time between getting the initial credential and the commencement of the 2-year period. And I mentioned it's March 1 through February 28th. Programs that are acceptable has to be relevant to the practice of social work, marriage and family therapy, professional counseling. So if you're working in a hospital and they want you to take CPR, that's not going to count. Most programs need to be pre-approved by a body. We're one of the pre-approval bodies, not the only one. Exceptions that colleges and universities, they don't need pre-approval, but the programs need to be relevant to the practice of social work, marriage and family therapy, professional counseling. Public and private agencies, up to 15 of the 30 hours in service can count, as long as it's relevant to the practice of social work. Okay, now, today, how many hours ago, Nadir? Well, about let's see, what time is it right now? It's 5:38. So about 3 hours ago, the state assembly passed our social work licensure compact, which is really a great success. We still needed to pass the Senate, which probably won't take place till the fall. And 29 states have already passed it. The compact, there's a commission right now, and it won't go into effect for about another year because they have to get all the rules set up. They got the data thing, et cetera, et cetera. So what will the compact do? The compact will allow a certified or licensed social worker in Wisconsin who to be able to provide services to clients in other compact states. So when, and you would apply for a special credential, a compact credential, you may have to pay a little extra money. Every state's going to handle that differently, but you'd apply for a compact licensure. And instead of having to get licensed or certified in the other states, um, you will be able to provide it in all the compact states. Um, so it's really good for continuity of services. I get questions all the time. My client has moved to another state. What do I do? They're going to live there for 3 months. I'm going to, live in Florida over the winter. What do I do? I'm going to be here temporarily. And these are all gray areas. This will solve the problem. It also will make it tremendously easier for people who are moving here from other states because it's really been a problem. It takes lots of time. Now, we are also at NASW working on an alternative to licensure exam bill because of the great disparities in pass rates. In Wisconsin, there's a much lower pass rate for Asian Americans, African Americans, anybody for whom English is a second language, and people over 50 who have life experience. And there's also no research that shows that the exam actually passage actually is a good indicator that you're going to be a good social work practitioner. That the social work programs are preparing that. But in Wisconsin, we'll never get rid of the exam, at least anytime in the near future, because for number one, the Democrats, the governor and the department, they've been fighting efforts by Republicans to undermine professions for decades. And so they don't want to do something like this, but they will agree to this bill. So the bill that we are proposing, and we're waiting to get hearings on it. Any of you who would like to help out, please email me because we're going to need people to testify. It allows social work graduates, BSW and MSW graduates who failed the national exam to get a provisional 3-year non-renewable credential that allow you to work as a social worker under supervision. After 2,000 hours of supervised practice with regular reports from your supervisor, you can get a regular credential, and then you can have a regular credential. You will not be able to get a compact unless you do take the exam. But the people I've talked to who none of them really are practicing out of state. So that is the end of my presentation, and I will be most happy to answer any questions. Um, Nadir, maybe you can let me know if there's any chat questions that I should answer.
Yeah, there are quite a few. I think
Mm,
let's just start with the compact question that I saw, and then I'm going to
okay.
jump
Okay.
to some ones that were asked previously. So the compact question is, how about the reverse of Illinois-based CACSW providing telehealth in Wisconsin? So who can practice? Do you want to just maybe quickly explain the compact again, Mark, and how it would work?
Yeah, so how the compact would work is that if you're one of the states that has passed the compact, so you're part of the compact, um, you can, as a practitioner, you can apply for a special compact license in your state. You might pay a little bit extra money, depends on the state, and then that will enable you to serve clients in any other state that has the compact. If the state doesn't have a compact, like right now, Illinois hasn't passed the compact, and neither has California, New York. There are a number of states. There's as I said, there's 29 states that have passed it. Another 10 or 12 are working on it, and some other states aren't working on it. So same thing. So um, does that answer the question?
I think that
Okay.
does.
Yes, it does.
Uh,
Thank you so much.
Sure, sure.
um, sorry, I'm trying to answer because there's a few that I'm going to put your email here in the chat actually. What about if somebody needs an accommodation for the ASWB exam, they specifically asked if they're unable to take it in person, what should they do? Is there an alternative path?
They are required to provide accommodation by, the ADA. Uh, so I can't answer the question on what all the different accommodations. I know they do allow people more time if they need it to take it. Um, they allow people to take dictionaries, but that's not necessarily that helpful to people. Um, sign people can provide deaf and reading. They can provide interpreters. Um, if somebody can't get there, um, uh, they would have to do something. I don't know what. But if if somebody is having problems with not getting the accommodation they need and they're a member of NASW, call me and we'll advocate for you. But they're required to provide accommodation. That's basically a national law, Americans for Disabilities Act.
Charlene, do you want to jump in? It sounds like you have a question.
Yes, thank you, Nadir. Yeah, so I had seen in the beginning of the PowerPoint, hi Mark,
Hi.
um that you were saying so if you so my understanding, if you don't have a license, you should not be called a social worker. But I know there are jobs that um you don't have to have a license depending on where you work. So is it unethical for them to title you as a social worker if you don't have a social work license?
It's illegal and unethical. Yes, if they're yes, you absolutely cannot call somebody a social worker um, if they're not certified or licensed. And I have in the past contacted agencies when I see them um, advertising a position under the title social worker and not requiring people to have a social work degree. So yeah, it's illegal, it's unethical. You can't, you're not supposed to do that.
Okay, you said a social worker degree or a social worker license?
Good question, Charlene. You have to
Mhm.
have a social work credential. I mean,
Credential.
there's some people that have gone through the
Mhm.
social work training certificate that don't have a social work degree, but they've been able to get a credential. And they can call themselves a social worker. You have to have either a CSW, CAPSW, CISW, or LCSW in order to work under a social work title position.
Okay, so having your bachelor's is still your title as a social worker.
You can't just have a bachelor's degree. You have to get
Okay,
the credential. So if
credential.
you if you have a BSW, but you
Mhm.
don't apply for a CS, you don't apply or to pass the exam for a CSW, you cannot work under a social work title position unless you have the credential.
Okay, okay, I understand. Um, so even with state exam, when you take that, do you have to repeat taking that test, or it's like you don't have to take it over the state test?
Uh, well, you have to pass both of them, and if you don't pass it, you have to take it again. I mean, the state test said is open book, so as I said, do your homework ahead of time. Look at the different things that they're going to test you on, and then
Mhm.
when you're taking it, look up the answers. Just take your time with that. But you have to pass them both. If you don't, you can retake them. As obviously there's costs involved with that. Now, if a job doesn't have the title social worker, you're not required to be certified or licensed. I encourage anybody doing direct practice, however, to become a certified social worker because of the protection of the client records. It's just a really good idea.
Okay, thank you.
Mark, if you've taken the state statute exam in the last 5 years and passed that, you are not required to retake that portion. You're just required to retake the other exam if you
Y-
failed at the ASWB.
Yeah, that's right. So if you become, let's say you start as a CSW, and then you take you pass the state and national exam, and then 2 or 3 years later you get your master's in social work degree. At that point you have to take the next level of the national exam, but you don't have to retake the state. It's been within 5 years.
Um, how do I know if my MSW program meets the clinical requirements for me to get my LCSW? My field placement is an outpatient mental health clinic.
Yeah, well, yeah, that definitely counts. So any social work program in Wisconsin, um, it's their job to know and advise people on the coursework and the field placement. If there's a problem, if you remember again, you can call me. But I'm in communication with all the MSW programs in the state. They're all aware of what the requirements are. That's their job. So I would just ask the person there.
And then there was a question about if DSPS isn't doing something to intervene, because I think earlier you talked about that being the place where we report things. And their example was if a caseworker is being unprofessional by making derogatory statements against a disabled child, what could people do?
That's terrible. Um, Bio, okay, so um, there's a number of avenues you can do. You definitely, if the person is a certified or licensed social worker, or for that matter, another professional through Department of Safety and Professional Services, you can file a complaint on their website. You know, the you can also if you can also contact that person's supervisor at the agency. If you're at the agency, you always have to think about you know, keeping your job and what's politically possible for you. But because the agency should not allow that. They should discipline or fire someone who makes derogatory comments. It's completely unacceptable. Um, Supervisor was involved. That's terrible. Then you contact the supervisor's supervisor. Um, or you can file a complaint through DSPS. They do allow anonymous complaints, uh, but it's a lot better if there's, they prefer people to not do it anonymously, but you definitely could. DSPS did nothing. That is terrible. Um, uh, yeah, I don't, I mean, the when a complaint is received at DSPS, the social work section has a group that meets in private session because it's confidential, and they'll look at the information provided. You know, the person complaining will have written up the thing, and then the person who's being complained against gives their response, and then the social work, the members of the section who are involved in this, working with the staff person, will make a decision if the complaint, if they should open the complaint or close it or ask for more information. That's how it works. So, I don't know, I can't answer what happened in this particular case, but those are the avenues when something unprofessional happens, either filing a complaint with DSPS, maybe contacting the head person at the agency. But world's not perfect. I mean, we all need to do, what we can and to ensure um, ethical practice, and hope that things happen the right way.
And this presentation will be made available to all of you afterwards, and you're free to share. And for those who are members of NASW, which is the largest organization of social workers in the state, you are able to have direct access to Marc Herstand for continued conversation and support. And also the exam prep workshop is free. I think I'm just gonna see what the comment
How
is.
many years do you say you need to keep your documentation? For 4 years. So it's basically for 2 certification periods. Like if you're like right now, you'd want to keep it for the 2 previous certification periods. So we're in 25 to 27. You'd want to keep it the 23 to 25 and 21 to 23. So for 2 previous certification periods, you want to keep it. Realistically, they're probably not going to go back 2. They're going to go back 1, if and when they do audits, but that's what we recommend people do.
And if you have trouble finding your certificates, the organization that provided you that training should have the
Right.
ability to
Right.
give that to you.
Right.
I don't see any other questions. I did want to just mention that NASW Wisconsin President Kim Howard is on the call.
Nadir, I do have a
Thank you,
question.
Nadir.
Yeah, go ahead, Craig.
So if you work at back to billing with different licensures and insurance, Medicare, Medicaid, if you're at and working at an outpatient clinic, being certified either 3575, if you're at an outpatient clinic that is not chapter 35 or 75, there are psychologists there, psychiatrists there who are willing to supervise you. What can you tell me about using incident to billing?
Yeah, that's beyond my expertise, incident to billing. But if you are a LCSW, you can directly, even you don't need to work at a state certified clinic to get reimbursed. Let's put it that way. So if you're an LC, yeah,
I'm an APSW
You're an
working with a psychologist, psychiatrist,
Right.
towards my hours.
yeah, well, you can work towards your hours, but you're not going to get at that clinic that's not state certified, but the DHS is not going to reimburse you for your services. And insurance companies, it's doubtful they will, but maybe you could negotiate with them, but it just is a lot more difficult to do that
Right,
if it's not.
with incident to it be the psychologist doing for my time. I'm actually doing their
Yeah.
work for them.
Yeah, and that's beyond my expertise, Craig.
Okay.
I do not know how that works, and
Okay, thank you.
yeah, yeah. Could you provide the link to that?
No, the booklet is available regardless of membership. If you stay on the call, I can find it really quick. And then Craig, I know you're an NASW Wisconsin member. And so if you reach out to us with specifics on that question, we can connect you with folks who might have
Right.
your
Through
answers.
the clinical network, yeah, I might be
Yeah.
able to connect someone there. Yeah.
Okay, thank you.
Oh, what I was mentioning is free is the exam. We offer there's different exam prep workshops and NASW Wisconsin offers one. That's a 2 to 3 hours. The next one that we're going to have is in our conference in the Dells, October 29th. But the booklet itself is something that ASWB provides. So
Right.
it's kind of
Yeah.
two things there. I just caught part of your question. I'm sorry.
Thank you.
Marc Herstand, we're almost at time. I don't know if I'm trying to answer that question really quick. I don't know if you want to give us any parting words.
Oh, well, if you're not a member, please join. We're, you know, all things I talked about is because of NASW, the reimbursement, the licensure, reimbursement by Medicaid, insurance companies, the compact that we're working on, the alternate licensure exam. We really need your support. And also, as I said, I provide assistance to members every day. I talk to people. So we are there. We have your back. If you have you have an issue with your employer and you need some financial assistance, we can help you apply for a legal defense grant through the national office, which I do usually once or twice a year. I have members with that. As I said, I provide ethical uh, uh, advice, assistance. We have members that have tremendous experience. So for clinical social workers, I get questions since I'm not a clinical social worker. I can answer and I refer it to our clinical network and they help. They have all the experience, decades of experience, all sorts of questions related to reimbursement and other issues. And we're also fighting for social justice, issues too. Um, Myself, I just today, I'm part of the Council on Mental Health, and we're sending a letter to our Wisconsin delegation and to in opposition to the national bill that will cut Medicaid and food stamps. And we're also sending a letter to our state people in the state saying that you need to be cognizant of the state budget if there are cuts to Medicaid. But we work on gun violence stuff and coalition and juvenile justice issues, Child Victims Act. So we're there as an advocate for you, for our profession, and for our clients, and we need all of your support. Um, we will mobilize members when it's critical time, and if you're not a member, we don't know how to we aren't able to reach you. So please join if you're not a member. And for those of you that are, thank you for being members. And we're here to support you and answer any questions that you might have that come up in your practice.
Thank you for those who could join. This does conclude our presentation.
Good day, everybody.